Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1. Questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Morning, Sarah. I'm Dr. Neil Strathmore. I'm a cardiologist, and you've been referred here from the Royal Children's Hospital for some further follow-up. So why don't you tell me a bit about yourself and what's been happening to you?
Well, I was born with a congenital heart, and I've had surgery in 1991 to correct that. And I was also, a pacemaker was also put in, and I've been seeing my cardiologist at the Royal Children's Hospital since then, and now I've come here.
So in 1991, how old were you?
I was 6.
And how old are you now?
I'm 23.
And so you obviously don't remember much about that, but what did your parents say was the problem with you when you had the surgery?
Well, they tried to explain what it was, which was transposition of the great vessels, but basically they told me that I was out of breath, and that's why I couldn't keep up with the other kids. So I was going to have an operation to make me better.
Do you have any memory at all of the surgery or of being in the hospital?
Yes. I remember the nurses, and I remember the playroom, and I remember finding it really difficult to walk after the surgery.
And so do you remember the fact that you weren't able to keep up with other children when you were little?
Not so much, but I remember my lips turning blue and my fingernails being blue and basically going blue when I ran out of breath or running too much.
So after you'd had the surgery, did you only ever have one lot of surgery, or did you have to have repeated operations?
It was just the one in 91.
Good. And so after that, how did you get on in terms of your exercise capacity?
I didn't start off doing too much, but then afterwards I had been doing ballet beforehand, so I continued on with that. And then I picked up some more dancing, and as I got fitter and older, I was doing that quite consistently.
So during your teenage years, how fit were you?
Fairly fit. I was doing about 5 hours of dance a week, so...
Gosh, that's quite a lot, really. That would be quite tiring.
It was.
And so have you kept that going since you've left school?
I have, but definitely not as much because I've been busy with uni and things like that.
So how fit are you now?
Probably not as fit as I'd like to be, but I'm still taking classes and walking regularly.
So do you have any symptoms? Do you have any shortness of breath?
No, not really. I try to keep watching other people when I'm in classes and making sure that I'm not more out of breath than they are. But normally when I'm turning around, everyone seems to be as puffed.
So if you walk up a hill or walk up a flight of stairs, do you get short of breath?
A little bit, but not enough to be concerning.
So you think you're about the same fitness of other girls of your age?
I think so.
Okay. Now, what about your health otherwise? Do you have any other health problems?
No.
You've already said your breathing's okay. Do you have any cough or sputum?
No,
Any wheezing or asthma?
not at all.
Your waterworks, do you have any problems with your urine or bladder?
No.
What about your bowels? They're all okay?
Yep.
And your appetite, and you don't get any nausea or vomiting or anything like that?
No.
And do you get any headaches?
Headaches I get every now and then, but I think that's mainly to do with stress.
Okay. Do you smoke?
No.
Alcohol?
Yes.
How much?
Every now and then.
So on an average week, how much would you drink?
It depends. Probably just once a week.
And would that be 3 or 4 drinks or more than that?
Probably no more than that.
Okay. So, what about recreational drugs?
No.
Not at all? Good. All right. Now, do you ever have any pain in the chest?
No, not at all.
Do you notice palpitations where your heart's beating fast?
No.
And have you ever had any blackouts or dizzy spells?
No, not at all.
Do your ankles ever swell up?
No, not that I've noticed.
Have you had any problems with excessive bleeding or bruising?
I notice I bruise quite easily if I just bump into things, but not enough to be too much of an issue.
Okay. Is there any family history of any heart problems?
No, not at all.
None of your parents or siblings had any congenital heart
No.
problems?
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello there, my name's John, and I'm going to be the doctor that's looking after you today.
Hello, John. Nice to meet you. And thanks for seeing me today.
How should I address you?
Please call me Kevin. Yeah, I'm here today because I had a bicycle accident on Sunday morning, and I was wondering if you could check me out. I've hurt my shoulder and my wrist, and I'm just a bit concerned about it.
Okay, Kevin, this is the first time that we've met, I believe.
Yes.
Can you tell me a little bit about yourself?
Well, I'm 53 years old. I'm in pretty good health. I'm about 85 kilograms. Probably could lose a bit of weight. My cholesterol's at lower than average levels by far.
And what about your blood pressure? Is somebody checking that regularly?
Yes, again, fine. If not on the low side, yeah. If anything, I tend to be on the low side of blood pressure and that type of thing.
And you're not on any medications at the moment?
No, nothing.
Are you allergic to anything?
No. Never been allergic to anything. I bicycle regularly about 100 to 150 kilometers a week.
Have you ever smoked?
No.
What about alcohol?
Not too much. I tend not to drink that much at all.
When you do drink, what do you prefer to drink?
Recently, I've been just having New Zealand whites, actually.
Yes. And how many glasses a night would you have?
In a week, 3 to 4. But that's like 2 on a Friday night and Sunday afternoon, that kind of drinking. It's pretty light, really.
Okay.
I'm conscious of drinking and smoking.
Any history in your family in terms of your mother and father with diabetes or heart attacks?
No, nothing like that. No, yeah, my mother was a heavy smoker. She was a very strong woman, but she smoked a lot. My father also had a bit of heart problems. He ended up having a pacemaker for 30 years of his life. I'm 53 years old. He got a pacemaker at 54, so I'm very conscious of staying in shape because of my father's experience. He had that for 30 years.
But it was never that he had a heart attack?
No, it was just simply the heart started. He lived till 84, 85 years old, so perhaps I should tell you one part of my life story. I was in West Africa for several years. Probably the biggest health crisis in my life is living in West Africa for a long time. Have a lot of stomach problems, problems with giardia, malaria, and actually amoebic dysentery. Those infections brought my weight down to about 60 kilograms. So just terrible, if you will, diarrhea constantly.
Yeah, and I imagine that you would have required medical treatment for your various conditions as well. Did you spend any time in hospital?
So we used to go to the local embassy and get treated by embassy medical staff. At the time, we were getting 500 milligrams of the anti-malaria medicine chloroquine. And then we had various antivirals and shots, but pretty minimal medical care, to be honest. Yeah, but since then I've been fine. Actually, I've been here in Australia about 20 years and was originally born and raised in the States.
I see. Can you tell me more about the accident?
Yes, just recently I went over the top of a friend I was bicycling with. Went over the top of him and ended up just smashing myself on the asphalt. And it hurt my shoulder. Yeah, it's terrible. To be honest, he wasn't paying attention. We had just stopped and they were just getting going again. It was Sunday morning. He slammed on his brakes and then I went over the top of him and then into the traffic. And luckily, I pushed both of us out of the way before a car came roaring past. And
wow, that sounds like quite a large accident. Everybody managed to walk away from it okay?
Yeah, we were laughing about it, you know.
You didn't need to call the ambulance or go to hospital for anything at the time?
No, we didn't even think about it. It was, again, we were laughing about it and went to the coffee shop. It was only, you know, as I came home and after the coming home and resting for a while, I realized I was in more pain than normal, if you will.
How long before the pain started to come on?
Right after having coffee, to be honest. I think the adrenaline went down and just coming home and finally kind of reflecting on the whole thing. After the accident, as you know, bicycles have...
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Good evening, Mr. Jones. It's Jane, one of the SHOs that's on call this evening. I'm calling from Ward 4 about a patient called Stephen Smith. Yeah, he's a 45-year-old gentleman, 5 days post-lap chole. Looking at the op note, it looks like it was quite a difficult procedure that was converted to open due to a difficult dissection around the bile duct. I've reviewed him as he's had an increased abdominal pain over the last couple of days, and this hasn't really settled with increasing amounts of opiate analgesia. Well, he was admitted to the ward 5 days ago after his surgery. He's normally fit and well, doesn't take any regular medications, and doesn't have any allergies. Since he's been with us, he's had some regular simple analgesia such as paracetamol, and also this evening increasing amounts of morphine. He's on day 5 of a course of oral coamoxiclav. Looking at his bloods, his white cells and CRP are showing an upward trend over the past 3 days.
Question 26. Now read the question.
This is Mr. Gervais. He's a 79-year-old gentleman. He's been had general malaise over the past few months, increasingly short of breath over the past few weeks. Was extremely short of breath today. 911 was called. When they arrived, he was tripoding, short of breath. His pulse ox on arrival was 69%. He bradyed down to a PEA arrest. They did 2 rounds of CPR, and there was a return of pulses in 8 minutes. And he was intubated in the field. He was brought into our hospital. Give you a little bit of history of Mr. Gervais. He has history of diabetes, hypertension, He had thyroid cancer back in 2006, which was, his thyroid was removed, and also received a local radiation then. He has an allergy to penicillin. And he's currently on a hypothermia protocol post-PEA arrest.
Okay.
Question 27. Now read the question.
Margot, my shift is coming to a close and it's time for bedside report. This is your new nurse, Patty. She's a great nurse. I'm leaving you in very experienced hands. And this is Audrey, Margot's daughter.
Hi, nice to meet you both. I'm replacing Sandy and I'll be with you till 7 a.m.
We're going to start report now, so feel free to add any information or ask any questions. Margot Carley is a 56-year-old that came through the emergency department and admitted for pneumonia.
Okay, Margot, can you please state your full name and date of birth?
Sure, Margot Carley, 6/26 of 60.
Thank you.
Margot presented to the emergency department early this morning with difficulty breathing, cough, and chest pain. She had a room air oxygen saturation of 84%. She has a history of a recently treated pneumonia, and we are currently giving her IV antibiotics and IV steroids through a PICC line on her right side that was placed this morning.
Question 28. Now read the question.
This is Mr. Gervais. He's a 79-year-old male with a history of thyroid carcinoma, originally diagnosed in 2006. We had a thyroidectomy as well as ablation, which reoccurred in April of 2009 in his thyroid as well as his lung. Also has a history of diabetes, OSA, paroxysmal atrial fibrillation, hypertension, bladder cancer, status post of TERP, and BCG, who came into the Wilmington ED early this morning, status post the PEA arrest at home. He, at home, had been complaining of worsening shortness of breath times 1 week. When they called EMS and they arrived at his house, he was noted to be in severe respiratory distress in the tripod position with an O2 sat of 68%.
Question 29. Now read the question.
So Mrs. Jones had surgery on her back. Today is her 3rd day post-op. She's doing excellent. She's getting up with 1 assist, utilizing a walker, ambulating to the bathroom, and Dr. Fandaka was her physician. Pain was pretty well controlled. Ranges up to a 7 at times, and taking 2 to 4 milligrams of dilaudid PO.
And you feel like your pain is getting well controlled with that dilaudid? Awesome. Right.
The last dose I gave was at 3:30, and she only took 2 milligrams, so she can have more at any time if needed. Tolerating her diet well. Do have the IV fluids running. Let's take a look at the pump together.
Question 30. Now read the question.
All right. This is Mr. Eddie Smith and his daughter Amanda. Amanda brought Mr. Smith in through the ED earlier, and he presented with some right-sided weakness and his speech was slightly slurred. He was admitted to us on a stroke care track, and he transferred up this morning. He has a history of diabetes and hypertension, and Amanda told me that he hasn't taken his blood pressure medications in about 2 weeks.
Yes, I picked up his medicines, but he wouldn't take them.
And I've already looked at those medicines, and his home med list is already on the chart, and it's been signed. He had a CT scan done before he arrived to the floor, and the results came back negative. And he just came back from MRI, and he has a CT angiogram ordered by his neurology consult, Dr. Elahi.
My CT was negative. Why did you run those two tests?
Well, even though your CT was negative, you still had to have the MRI because it's a more conclusive test, and it tells the doctor more about what's going on. It can show some things that the CT wouldn't show, so they would still order that test.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36.
Inducing labour, that's breaking a woman's waters and making the uterus contract more strongly. Is it safe? It's an important question, and a large randomised trial has found the answer, at least for some women. The lead author was Bill Grobman, who's Professor of Obstetrics and Gynecology at Northwestern University in Chicago. I spoke to him earlier.
What was being tested was the concept that for many years there has been a belief, really deeply ingrained, that labour induction leads to a greater chance of cesarean delivery. The truth is, though, that it's based on relatively long ago studies for which, and I'm happy to describe why, there has been a fundamental misinterpretation of the results such that we misunderstood the clinical implications.
Well, let's just talk about this misunderstanding. And just to be clear, when we're talking about labour induction, we're talking about breaking the waters and putting up a drip which makes the uterus contract.
When we're talking about labour induction, there's not a single way to do it, but that typically you're right.
So was the problem in the past that labour induction was done on women in distress and therefore it was a biased population? They were already in strife when they were induced?
Well, I think it's actually two issues. One is the issue that you already referred to, which is that so often women were being induced for a medical reason. Something else was going on. Either the fetus was in need of being delivered or the mother herself had a complication that led to delivery being recommended. And clearly those were both situations that led to a higher chance of cesarean. But the other really important thing was that the studies that were done, and when I say studies, I very much mean observational studies, not trials, but studies where people went back and looked at records of women who had delivered, where women who were being induced were compared to women in spontaneous labor at the exact same gestational age. And I think it is undeniable that if you make that comparison, that there's a greater chance of cesarean among women who were being induced than women in spontaneous labor at the exact same gestational age.
Why is that?
Oh, well, I don't know why it necessarily is, but it just is. It's something that's observed, something that when people studied it, not with the clinical trial, but with observational data, that happened, and very consistently.
But these are biased studies because they weren't randomized.
Let me put it this way. Induction of labor is an option. I can choose to be induced or not to be induced. Spontaneous labor is not at the exact same day is not an option. Women may spontaneously have a labor, but also may not. They may not go into labor for another 2 weeks, and every week that goes by, the chance of cesarean increases. They may not go into labor and get to a point where induction of labor becomes recommended, but now it's an induction 1 or 2 or 3 weeks later. And so if you're making a clinical decision, and the clinical decision is, do I choose to be induced now or do I not? The alternative is not spontaneous labor on the same day.
It's waiting.
The alternative is waiting, which may end up in spontaneous labor but may not, or may end up in spontaneous labor weeks later. And when observational studies were constructed like that, studies that reflected the actual clinical situation, you actually very consistently did not see the association of induction with cesarean delivery.
So now you've done a randomized trial where you actually get women and you randomize them to induction or waiting.
That's exactly right. So,
and this is in women who've never had a baby before.
That's right. And so that's, I think, an important point. Most of the concern with regard to cesarean delivery was with regard to women who had never had a baby before, women on their first birth. And I should also say this isn't about women who have medical complications for which there's a medical indication for induction. This was really a question of women who had no other reason, no standard reason to have induction recommended. Was it indeed true that induction would lead to an increased risk of cesarean, or might it be, as the more recent observational studies suggested, that induction didn't increase or even decrease the chance of cesarean and maybe also improve the outcome of their baby?
And sitting behind this is a concern about a high caesarean section rate, complications in second pregnancies. You're kind of condemning yourself or committing yourself to a second caesarean, and sometimes the babies don't do as well.
I think what we would say is that, for any woman who desires a vaginal birth, that we want to do everything we can to try to optimize that chance. And clearly, if someone can have an uncomplicated vaginal birth versus an uncomplicated cesarean, both in terms of short-term complications and long-term complications, including complications for future pregnancies, it's preferable to have a vaginal birth. What we want to get rid of are unnecessary cesarean deliveries that would have potentially preventable, and the health of the mother and her child or children are preserved.
Okay, so you took about 3,000 women, not a small study. Well, it's actually, 6,000 women.
Yeah.
3,000 were assigned to labour induction at 39 weeks, and 3,000 waited to see whether they went into spontaneous labour, and they were low risk, as you said. And your outcome was mother's health, baby's health, and caesarean section. Is that right?
Yeah, that's exactly right. It was 3,000 women in each group, low risk nulliparous women or women on their first birth, randomized to induction at 39 weeks or expectant management or waiting. And not forever, because there's still an upper limit at which in the modern day is considered sort of acceptable practice, but till about 42 weeks would be the upper limit.
What did you find?
Well, what we found was that women who were randomized to labor induction had a significantly lower chance of cesarean delivery, so about a 15% relative risk decrease in cesarean delivery. Women who were randomized to induction of labor delivered babies who were significantly less likely to need extra respiratory support, like having a tube put down their throat to help them breathe or requiring high amounts of oxygen. Women who were induced had a lower chance of having high blood pressure problems at the end of their pregnancy, sometimes called preeclampsia. And also they reported less overall pain, and they reported a greater sense of control over their labor process and a greater sense of agency.
Well, that sounds pretty impressive. We'll come back to the implications in a moment. But one of the risks here is you get the scent of the patient.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Phantom odour perception is where you perceive an odour which, when you search for it in your immediate environment, you can't find where it's coming from, and in fact turns out not to be real. Here's Serge Negus, who's a producer at Triple J, telling James Bullen of the Health Report about his experience.
How did you come to have these phantom smells?
I had a traumatic brain injury from a skateboarding accident where I fractured my skull and had part of it removed and this titanium alloy plastic mould put in there. And one of the things that my mum did when she came in was put some lavender oil on my sheets at the hospital bed, and then she presented the lavender oil to my nose and I literally couldn't smell it. And so that was when I discovered that I couldn't smell anymore. And the doctors said that it's one of the most common things that you can have happen after having a head injury is you lose basically your olfactory nerve and a lot of taste too.
How did you feel when you realised that was happening?
You can get really bad smells with these phantom smells, you know, things like burning flesh and these sorts of things, or really unnatural smells. I didn't get that. My smells were battered fish and chips and stuff like that, and passion fruit and mango and different things like that were really nice, and they came with a sense of euphoria. So for me, I didn't mind because I'd totally lost my sense of smell. So having these kind of phantom smells for me actually worked out, but I know that for some people it can be the opposite, and they can have smells that really are quite intense and very dark, and so people actually try and figure out ways of getting rid of their phantosmia, which I don't even know if it's possible. Apparently some people have tried to have their olfactories removed completely to try and stop it, but I don't know if it even works. The science around it, it's not that strong, I believe. But my experience of phantosmia has been quite positive.
And do you ever get the bad smells, or has it pretty much been good for you?
The only time I've ever had slightly bad smells have been smells that I literally couldn't describe to you. They're so unnatural. They come from such a weird place that because my brain's creating them basically, that I'm confused by them. I'm like, what even is that? That's a smell that I've never even smelled before, obviously, because it's my brain's creating this fake smell. But no, I've never had any of the bad ones. The worst thing I've had, which I actually kind of liked, was the smell of fresh cow manure. Do you ever play the game Which Would You Rather? And I'd always say to somebody, if you said to me, which would you rather, never be able to smell again or only be able to smell fresh cow manure for the rest of your life? I was like, well, you know what? Having experienced that, I would go with fresh cow manure for the rest of my life.
And how long do they last, and how powerful are they while they're going on?
They can last for a couple of days, once every 2 to 3 weeks, but sometimes they can be a couple of months without experiencing it. But because, like I said, I've had this positive experience with phantom smells, I look forward to them when they do happen, and so I'd actually like them to happen more.
Serge Negus throwing cowpats at James Bullen. Well, head injury is only one cause of phantom odour perception. To find out how common it is and what factors might be linked to it, Kathy Bainbridge and her colleagues at the US National Institute on Deafness and Other Communications Disorders studied a large population in the United States.
For some people, they pick up an odor. It's often unpleasant, or it's often described as a burning odor. And you might ask your friend or your partner, your spouse, hey, what's that smell? Is something burning? And they don't smell it at all. So it's an odor perception for which there's really no source, no identifiable source in the environment.
And how bothered are people by it?
I think it varies. Some people just describe it as kind of pesky, but for sure there's a subset of people who are really debilitated by this condition and who scour their house looking for the odor. My co-author, Dr. Don Leopold, he's described people who ripped up carpeting in order to try to find the source of the odor, and there really is nothing to be found.
It's under the radar, really, this issue.
It's never been studied in such a large population as the study that I participated in.
Tell us what you did.
In the United States, there's an ongoing national health survey, and it's been going on in its current form since 1999. And beginning in 2011, we had the opportunity to add a battery of smell and also taste questions and a couple of different physical exams. So we took the opportunity to add a question about phantom odors. So we collected, over the course of 4 years, data on over 7,000 people. And it turns out that 6.5% of adults over the age of 40 in the United States are willing to report that they smell phantom odors.
That sounds like an extraordinary percentage.
Yeah, it's surprisingly big. Our question was broad. It was, do you sometimes smell odors that are bad or foul or unpleasant? So we don't have the data to ask of the 6.5%, what proportion are really, really troubled by it. We don't have that data. We don't have data.
But some phantom odours are quite pleasant, aren't they?
The way we captured it in the survey, we phrased it as bad or burning, but I've heard from some people smell like cinnamon. A gentleman told me he smelled cinnamon and he associated that with his father. And they tend to be warm smells or hot smells. I've heard burnt milk, stale or hot bleach.
So you're always running into the kitchen to find out what's spilt over. So what factors, because this was the other thing that you looked at, is what predicted whether somebody had a phantom odour? Because it sounds from this that you've probably underestimated, if you haven't looked for the good odours, you've probably underestimated the phantom odour prevalence, but let's put that to one side. What were the factors predicting whether or not somebody was more likely than not to experience phantom odours?
Women were much more likely to report phantom odors than men.
That is the end of Part C. You now have 2 minutes to check your answers.